Thank you, Deputy Speaker. One of my constituents, Denise Newton, summed up where we find ourselves right now. Quoting an academic that she'd been listening to on the radio as she drove to meet me and the Leader of the Opposition last week, Denise said, "COVID has been like an X-ray, showing where all the broken bits are." Denise was speaking at a roundtable discussion I held with a small group of women who have a loved one in aged care. I wanted to give the opposition leader a glimpse of the sort of problems I hear from families of aged care residents in my electorate, and I know they'll be similar to those being heard right round the country. Some of these women have known that the system has been broken for a really long time, years, and they've actively tried to improve it and have not been taken seriously by any of those who have the power to fix it. That would be those on the other side. In fact, in presenting a list of issues to the regulator during a visit to a facility, they were told, "We're not the complaints department." Now, if a regulator won't hear of the problems being raised by residents' families, who will? Denise, Lisa, Sandra and Sue spoke passionately but calmly about the fears they have for the health of their loved ones residing in the Uniting Hawkesbury Richmond facility. Now, this facility was recently among 104 aged care facilities issued with a non-compliance notice about infection control. I acknowledge that Uniting says they've worked hard since then to implement a plan to improve infection control, and they say they're confident that they'll demonstrate full compliance with all the standards and requirements. I don't doubt their efforts or their intentions to protect their residents and their team members, knowing that those staff themselves have so much pressure on them at the moment and that they are at a higher risk than any of us here, and yet they earn a minimum wage. They are to be absolutely congratulated for the work that they're doing, but they can't do it alone. I've visited the facility on a number of occasions. The staff have been a delight, from those slogging away in the laundry to those who care for residents like Ken, Lisa's dad, who just turned 90. But that doesn't change the fact that these families have had long-running issues that I think go to the broken bits of the system, the bits that COVID is really exposing. Not enough staff, which means there isn't the time or people to provide the quality of care that I'd expect for my family. The other two participants at my round table, Liz and Joe, who have family members in other facilities, I think were shocked at what they were hearing. But we have to talk about this. That's why the Royal Commission is so important and so overdue. That's why it's not good enough for the Prime Minister to give a belated apology to families of those who've died, for whom all of us here have the deepest of sympathies. And that's why it's not enough for the Prime Minister to try and pretend he doesn't have full and total responsibility for aged care. The tragic deaths of people in aged care with COVID, and we're at over 330 so far, and no one thinks that that number won't rise. It strikes fear into the heart of anyone with a family member in care, and that includes me. The report on Newmarch House, when 19 people died, 17 of those deaths being directly linked to COVID, and Dorothy Henderson Lodge, where 6 lives were lost, was kept hidden by the government even though they had it in April. Back in May, I called on the Morrison government to learn what went wrong in those facilities, particularly because Newmarch House is just outside my electorate, and I had residents of the Hawkesbury and Blue Mountains who had family members there. They didn't learn, the government didn't learn from those lessons, and Victoria's heartbreaking experience shows us that. They knew from Newmarch that as many as 90% of a workforce could be out of action if COVID got into a facility. But in late July, the Prime Minister said it couldn't have been anticipated or foreshadowed. That is just not true. The report into Newmarch shows it could and should have been anticipated and planned for. The need for more PPE should have been anticipated. It was clear to me in conversations with the Minister and others during the Newmarch disaster that PPE was being reserved for outbreaks, not being used to prevent them. And why was there no obvious plan to ensure that every resident had a way of communicating directly with their families if they were able to? The silence for families during the Newmarch debacle was agony. And that's why Sandra, Sue, Denise, Lisa, Joe and Liz and everybody else who has a parent or a wife or a husband in aged care
I'll
deserves...
call the member for Barker.